From the feds starting to take a harder approach with mandatory vaccines for travel and federal workspaces, to the province pushing back its own policies on testing and isolating. Now throw in some elections. There's a lot on the plate for Canadians this fall. Now, Royal University political scientist Lori Williams joins us. Lori, how do you think Canadians and Albertans are feeling when it comes to government and the pandemic?
I think that the constant sort of change in terms of what the pandemic is doing and what we need to do to protect ourselves has been a real challenge for a lot of people. And if the changes are due to new information that we had no way of anticipating, I think people are going to be relatively understanding. But when it's a reversal of policy based on something that most medical experts, including epidemiologists and virologists, most of them thought that the original removal of these protective measures was unjustified. So I think people are relieved that the government has restored at least some of the measures that were in place, hoping that we can manage this fourth wave, whatever it winds up looking like. But I think there are serious questions now being raised about the leadership being exercised by this government on a very serious healthcare matter.
How hard is the messaging when you have the province of Alberta trying to be the first to cross the finish line with COVID, and then you have the feds who have a very different approach? How hard is this to have some kind of understanding or unified front moving forward to get through this pandemic?
Well, it is really difficult because there are lots of people that are traveling from one part of Canada to another part of Canada, and they're meeting different policies and rules, regulations, risks in different places. The hope, I think, would have been that the governments that Canadians voted for would work together to try to find some sort of common ground, some reasonable measures that would look somewhat consistent across the country, particularly on the idea of providing a vaccine passport, or whatever you want to call it, something that enables those who want or need it to verify that somebody's had a vaccine. It enables people to assess the risk in certain situations and to take appropriate precautions in those circumstances. And unfortunately, most of Canada is willing to employ something like a vaccine passport, but Alberta is again the outlier on that, and unwilling because it's somehow not a matter of public health, but a matter of personal freedom somehow.
Thanks for your time, Lori Williams from MRU.